is piriformis syndrome? This is a condition in which the piriformis muscle spasms and causes buttock pain. This muscle can also press against and irritate the nearby sciatic nerve, causing numbness, pain, and tingling down the leg and foot. What is the piriformis muscle? This muscle begins inside the pelvis and connects to the upper surface of each femur. It assists in rotating the hip and turning the leg and foot outward. This muscle runs diagonally with the sciatic nerve, running vertically directly beneath it. What is the sciatic nerve? This nerve starts as a collection of nerve roots that exit the lower spine and combine into one large nerve that runs down the leg and into the foot. So why does this happen? That's still relatively a mystery. It's believed, though, that the condition begins when the piriformis goes into spasm and tightens against the nerve. In some cases, the muscle may have been damaged due to an injury, which causes scar tissue buildup. What are the symptoms? Piriformis syndrome most commonly causes pain that will radiate down the back of the leg and into the foot. The pain may be felt down only one leg, or it can be felt bilaterally. Most people say they feel a sensation of vague tingling. Sometimes the symptoms are similar to those in people with disc herniations. What techniques are used to diagnose piriformis syndrome? The doctor will take a history to determine the effect your pain has on your activities of daily living. Your posture and how you walk will be examined, as well as where exactly your pain is. X-rays are usually ordered to determine wear and tear on the SI joint. There are other radiological tests that can be ordered, such as an MRI, neurography, and a bone scan. The most accurate way to tell if the piriformis muscle is the cause of pain is with a diagnostic injection into the muscle.
Okay, so there are two types of interventions that can occur to help relieve piriformis syndrome. The first one being the non-surgical, and there can be multiple ways to attack this. The first one could be using NSAIDs, which can be prescribed or over the counter. The use of Botox injections to the piriformis itself, followed by stretching to help lengthen the muscle, which can help relieve the pain. We can also correct the biomechanical abnormalities, which could be leg length discrepancy, pelvic alignment, foot, ankle, or postural problems, which can all be fixed pretty easily. Lifestyle modifications to avoid irritation. That can be sitting too long, type of workouts that they do, etc. Specific stretches for the piriformis, as well as the adductors. The use of deep tissue massage, core stability. With the core stability, this just helps relax the muscle a little bit more by putting more stress on other muscles that can support the body other than the piriformis. And the use of electrotherapy. The main one that was talked about was the use of ultrasound. That just helps get deeper to the tissue that they're trying to work on. And then patients with this issue more than likely are going to see a physical therapist 2 to 3 times a week for 6 to 8 weeks. Normal treatment, like stated earlier, the use of ultrasound, hands-on with the deep tissue, and the best for the condition is just stretch piriformis muscle. And then as the symptoms decrease, the PT will usually advance the rehab program to include the posture training, muscle strengthening around that area, and just conditioning of the body as a whole. And the next one would be the surgical release of the piriformis. Along with any other surgery, it just gives added risk to the person itself by opening the skin and opening up to other factors. But the surgery is done by making a small incision in the buttocks, which is about 3 inches long. And then the way that the surgeon gets to the piriformis, the way that the glute max fibers lay, they're split, gives the open area for the surgeon to get to. And then when the muscle is found, the surgeon cuts at the attachment site of the greater trochanter, which releases the muscle, and hopefully in the end, the sciatic nerve, which is being compressed, will help then be released. Now for the surgical rehab approach, which lasts up to 4 to 6 weeks and can take up to 3 months for full recovery. The PT will provide strength and function exercises to help the healing process. and as they see fit, increase the intensity as the healing continues. Once released from the care of a PT, the patient is given an at-home program to follow as the healing process is still going on, and I'm sure they will get a deadline of when they can stop that. Also, once they're done with their rehab, the PT will help guide them in activities that they can continue right away and those that they want them to wait a little bit longer to go back to, which can irritate the piriformis even more. So it just comes down to how the therapist approaches this, of how long and how quickly they can get back to their daily living activities. Thank you for listening, and if you have any questions, feel free to ask during our workshop, and we'll try our best to help you answer those questions.